Hi, I'm Dr. Joseph Baker from the Limerick Chiropractic Center, and I want to talk to you tonight about your hips. Now, many of you, as you saw the title for this workshop's Balancing the Hips, well, your first thought of, the imbalance. What do I see? I see the fact that somebody's walking and I see their posture and things aren't very level, and I want to go directly to what I see in order to fix the problem. See, the sad thing is that as we have these conversations, the problem doesn't start in the hips. The problem starts somewhere else. See, we've been told and we've been taught so very often that where the pain is where the problem is. That where I see that signal has got to be what's going on. And the problem is that oftentimes as we just simply dive in and isolate that one particular area and say, I can control the hips, I can control this one area, I'm going to fix and correct this one issue. And then we get frustrated because we realize that we're not actually dealing with the root cause. And the problem just restores and returns again and again and again. You know, the sad thing is that this is probably many of your stories where you've been told, hey, listen, you know what? Your low back is out of position. Your hips are rotated. You have muscular imbalance that's creating this altered position of your hips and your pelvis. And yet, unless we're doing a full and complete examination and testing the system, we really don't know. And this is why we're pausing today. And we're actually going to deal with the foundation of our body. And in turn, we're going to actually be talking about going about 3.5 feet downward and looking at the feet. Because the feet, as the foundation of this body of ours, it gives us oftentimes that first answer and the most important answer of what causes our hips and our pelvis to come out of balance. And if we want to balance the body, then guess what? We got to get down to the foundation. Now, for some of you that are already patients at the Limerick Chiropractic Center, well, you've had a complete chiropractic evaluation, and you can remember day one when we did your very first posture check. That very first posture check, we started down at your feet, and we worked your way up through the entire body. Now, for some of you that are watching this conversation tonight, you know what? Maybe you're not patients at the Limerick Chiropractic Center. Maybe you're at another chiropractic office, or maybe you've never been under chiropractic care, but you're just simply investigating, well, what are those things that I need to know to help myself? Well, let me tell you, at the end of the workshop today, at the end of this very brief conversation, listen, we're going to do 3 things. I'm going to ask you to like this video. I'm going to ask you to make sure that you're leaving me a comment, and in that comment section, tell me that you need to get tested. We'll make sure that you have that opportunity of just simply coming in and having that complimentary opportunity of just simply getting tested. But the final thing I'm going to ask you to do is share this information. There are so many people out there that are probably just like you and just like many other individuals that they don't know. And they're looking for answers. And you're able to help give them that hope. So let's dig into this. Because for me, I recognize you're probably very, very much like me from the standpoint that I'm very visual in nature. And oftentimes that visual aspect, that visual learning cue, helps me unlock the next steps. Now, this picture helps to diagram and helps to demonstrate many of the different altered postural positions for the feet. But one of the things that I want to draw your attention to is this particular picture here. As we start to see the chain reaction. Now, many of you, if you have an older house, you know, the building that I practice in, it's over 125 years old. It's got a stone foundation. And in turn, when we first bought this building, there were cracks and lines in the plaster up on the second floor. And we knew if we wanted to just whitewash it and cover it over, well, that would have lasted for a little bit. But if we actually wanted to stop those cracks from getting worse in the future, we had to do one thing. We had to go into the basement and we had to secure and stabilize the foundation. Well, listen, your body is no different. It's exactly the same thing. You have to stabilize from the base up in order to actually help yourself level the pelvis out. Because listen, as soon as we lose that normal, that great arch that we're supposed to have in the feet, guess what? Your foot starts to roll in. When it rolls in, it drives that knee in and turns it into the inside. Now, where the knee goes, well, guess what? That hip follows. So as that knee goes in, this hip comes down and forward, and we can see how that throws those hips out of balance. And in fact, up above at the shoulders, we'll see it continue normally in that opposite direction as your innate intelligence that runs your body, tries to make sure that your eyes are level with the horizon. Now, most people are astonished at this, but it's called the righting reflex. Your brain is wired. It wants to keep your eyes level with the horizon, so it's going to do whatever it has to do to accomplish that simple goal. Yes, if you do something like the field sobriety test, you're removing that righting reflex. That's why you feel yourself wiggling or drifting back and forth as you have your eyes closed. So we want to make sure that we're getting their feet checked. And listen, nobody is immune to this. In fact, unfortunately for our female population, there's 2 times during your lifetime that are really difficult times in regards to your feet. One is during a pregnancy, because we have that relaxin hormone that courses through our system in order to allow the muscles, the tendons, the ligaments all to relax and stretch, to allow the birthing canal to widen the way it's supposed to make the delivery process just easier. Well, let's do reality. So when we loosen up all those tissues that are responsible for holding those joints in place, and we add gravity besides the increase in the weight that goes through those feet, and many of us do like 10,000 steps a day, that's a lot of excess force and pressure. Your feet are going to widen. They're going to flatten out and they're going to widen. And the problem is that we have the same thing that goes through the body during menopause, where there's a shift in the estrogen or progesterone ratio, and yes, women's feet, they widen during that process of time, that period of time. And in turn, listen, that lasts for 10 years. So you can be through a constant transition if you're not supporting the body the way it's supposed to. Do we ever want to allow for a problem like that to develop? Because once it happens, listen, it's going to continue to worsen with time. That's why older women end up wearing what I consider those old black boat shoes. They look like those medical shoes that nobody wants to pick off the shelf. But yeah, that's the only thing that their foot fits into. Wider and wider shoes. All right? So nobody is immune. In fact, the problem is that, listen, we look like our parents on the outside. We look like them on the inside. And we look like their feet too. And guess what? Some of us, when we look at our parents' feet, we see the corns, we see the bunions, we see the flat-footedness, we see all the different things that are going on. Guess what? Most times, that's exactly where we're headed. So yes, there's a genetic component. There's that hereditary component also that comes into play. And we want to make sure that, we are looking at this, comparing it to that absolute norm that's supposed to be there in order to make sure that we're setting the spine up for the easiest possible maintenance. Because part of the reason for those arches in the feet is to drive force away from the body. But when those arches aren't there, guess what? Your knees, your hips, your low back has to absorb all that additional force and pressure. And anything that we use more than it's supposed to, guess what? It's going to wear down more quickly than it was intended. And I don't care whether you want to call it degeneration, arthritis, decay, it doesn't matter. It's all the same thing. Wearing the body out more quickly than it's supposed to. Now, I guarantee you, there's many of you out there, if you've never been tested, you're starting to think, well, you know what? What does this actually look like? Well, let me tell you, this is what it looks like on an x-ray, where we can see how the hips, I mean, in this case, 17 millimeters dropped down on one side, and most of that was caused by this person's foot not having the proper arch in place, and it allowing the foot to actually drive down and in, causing the knee to come in, dropping that hip down and forward. That's why we see this, and you can see how that spine just simply curves to the side. Now, this is just one example, and this isn't your example. And this is why I say you need to get tested, because in the end, that knowledge is power. And if we're not doing our part, which is getting tested, then we're not going to get the help that we need. See, like anything, when we start looking at this body of ours, something simple and easy as taking that picture of the bottom of your feet, having it scanned, helps to better understand what's the most appropriate thing. For some, listen, you know what? Adjustments. Moving those bones, creating that motion allows for the joints to restore back into their normal position. Sometimes what needs to happen is, yes, we need to utilize things like orthotics. And there's times when in the orthotic, we actually need to build a lift, a shim, because the sad thing is that this imbalance has been there for so long that your body needs the additional help to artificially raise it or shim it up back to where it's supposed to be, so that your body has that capability of actually migrating and restoring the normal alignment within the spine and in the hips and the pelvis. But the one thing I want to encourage you is to do that most important thing, is to get tested. See, in the end, I don't know whether you have a problem with your hips, whether you have a problem with your feet. But what I do know is that most individuals don't do that first most important thing, to simply get tested, to simply get checked. See, if we do that most important thing, it gives us knowledge about what's the next most right thing for us to do. Listen, there's a lot of great things out there. There's a lot of great tools and applications that we could talk about, but that doesn't mean that it's right for you. I'm not going to tell you based upon this video that you need orthotics. I'm not going to tell you based upon this video that you need to get adjusted or do exercises or anything else. I'm just simply going to recommend that you make it a priority to get tested and to get checked. If we want to balance the hips, let's understand the actual root cause of the problem. As I started with, listen, I'm going to ask you to do 3 things. Number 1, like this video. It's going to help to make sure that other people actually see this information. Number 2 is to leave me a comment. If there's something that you learned, that's great. I want to hear about it. If you need to get tested, put that in there to make sure that we're able to circle around, help you make sure that you get tested. And the third thing is to share this information with others. Because just like you, listen, it was 10 or 15 minutes. 10 or 15 minutes to better understand how you could possibly balance these hips. There's people out there, they don't know what you know. And they need your help. And that comes from just simply sharing this information with your Facebook family. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.